Get the team back together. Hey, buddy. I'm hungry. Good to see you.
Great to see you guys. I'm glad we got the band back together. Just wanted to have you back to just take some photographs, make sure you're happy, and then just discuss how your experience has been over the last year or so.
That's great.
It'll be great. I'll be honest with you. The full head of hair makes me want to have hair on my back, and I don't have any.
We don't offer that, but I know a guy.
We'll get you manscaped.
Yeah, we'll get you done.
Thanks, buddy.
All right, man. All right, come on in.
Yeah,
Come
yeah.
on, right this way. After you too.
All right, thank you.
You got it. Hello, this is Dr. Ken Anderson at the Anderson Center for Hair, and today we've got some very special guests. On the left, we have Southside Steve,
You come on.
and we've got Axel,
Shabba-doo. Everybody needs a catchphrase.
Gotta have one.
my two favorite disc jockeys. So it's been a minute, guys. They both had hair transplants a little over a year ago, and I guess I haven't seen you guys since I was last in studio. I used to go down, right down to Sandy Springs there for the to do some in-studio work with you guys on Rock 100.5. I guess I haven't seen you in a minute.
Yeah, it's been a minute.
Yeah, those I had a lot of fun in that.
It was good times.
It was interesting. We were talking, and I would just be thinking about hair restoration, and I saw Axel. So Steve, you were beside me,
Right.
and then I saw Axel over to the computer screen. So just your two eyes looking at me, no face, and I remember answering a question. And you got to put your thoughts together as you're talking. And I thought, okay, there are tens of thousands of people listening right to every word. And I almost got caught up. Do you guys?
It's funny, we never think about that because that's what engages the nervousness. We just, in a radio, you want to communicate. Most people are listening solely in the car. So the key to radio, good radio, is communicating to one person. So I always just think about talking to one person. When you start thinking about the masses, it'll trip you up. You wouldn't be as relaxed.
Not me, due to vanity, which is why I'm here and why I love hair. I picture every face listening to me, and I'm like, "What's up?" It's like I can see a million faces,
Huh?
and you just want to rock.
Did you think about that?
Nice Bon Jovi.
Thank you.
When you first started in radio, did you think about like all the people that are out there?
Yeah, but you're taught early on to communicate to that one person.
Yeah.
So, and that helps you relax and that helps you think clearly.
Yeah.
Yeah, so I've always kind of thought that way, and it just makes it an easier thing to do on our.
I will say that people that do radio probably make it look easy. And,
Yeah.
both of us with over 30 years in this market in Atlanta, when you watch us, you're like, oh, I can do this. But it's funny when people get a mic in front of their face and a headset on, they're like, but you did great. You were a pro.
You were an easy guest because we both like hair, like full heads of hair. I got the nickname Axel because I had hair down on my belt loops the very first day I walked into a radio station. And as it started to recede over the years, well, the 90s, everybody was cutting their hair. So I cut my hair. And
Not me. I stayed with it.
And then it started to recede. So I was like, it's hard to grow back out. And I've always been conscious of the receding hairline.
Yeah.
And so when you came in, I did have a million questions. I wanted to know how this whole thing worked. And you had all the answers. So it was fascinating. It was really easy radio, too, because we never had to worry about throwing something to you and stumping you. I mean, you're the best in the business. And you can answer all the questions.
That is pretty much the bragging point when you talk about, it was his one procedure. I've had a few procedures through people, but I knew who you were. And when you can have a doctor that is ranked top 20 in the world work on your hair, you brag about that. You talk about that.
Well, I just work hard. I don't know. But yeah, I had a lot of fun. It was interesting. It's funny you mentioned that because when I started thinking about all the people out there, I'm like, bro, no one talked to me about it, but it's kind of a in public speaking, you want to just sort of when you got a bunch of people in front of you, you focus on like as if you're talking to one person. And yeah, I do talk about this stuff every day, so that made it pretty easy. If I had to talk about some random subject, that might have been more difficult, but.
Yeah,
anyway.
you're the pro at this. And one of the things that I thought was great, too, and the reason why I felt so comfortable coming to you is not only do you do this procedure, but your background is in cosmetic surgery, Beverly Hills, and the way you talked about how, the hair grows so differently. Like naturally, it doesn't all grow straight up and down. So I'm not going to put them in straight up and down.
Yeah.
You're not going to look like one of these bad procedures. There's an art to it. And if you can handle plastic surgery, then the hair thing is almost like a cakewalk. And the fact that you train all of these other doctors around the world to come in and learn this procedure and learn your techniques made me go, I feel comfortable about going to Dr. Anderson versus some of the other guys you see on billboards.
That's
Yeah.
it.
Yeah, we don't do billboards. You know, I've got a great team around me, and I work hard. And yes, I'm a facial plastic surgeon. Hair transplant surgery is one procedure in the panoply of facial plastic surgery, and I decided that I would just concentrate and focus on this one sub-segment. So I'm a sub-surgical specialist, I guess. But yeah, it's been great. And but anyway, so you guys, it's been a little over a year since your procedures. We're here just to discuss how the last year has been. What have you noticed about your hair? Has anyone said anything? Steve, why don't you go first? Let us know. How have things been with your hair?
They're pretty good. Like if you notice, I've got long hair and it's kind of blonde. I'm digging the blonde thing. My wife hates it, but I love it. So what I did is everything in the front. You did some work with me in the front, and not to jump on my brother here, but he has a perfect head. Most people, when they start to lose their hair, male pattern baldness is usually at the top of the head. And it's that small golf ball that turns into a baseball, turns into a softball. Then around that time, you start losing it in the front. But for me, that's what I had. So it was a matter of replacing it on top. So nobody's going to notice that when you're wearing your hair long. Nobody. But the thing that I know is I'm not having to use long hair to cover it up. It's all growing. And then I'm good having my hair down. I'm great swimming. I don't care. I let my hair dry naturally. So if I'm wearing a ball cap, usually it's because I haven't washed my hair. The only thing I use that a lot of guys don't with long hair is I put a little hairspray on or a little gel because of the flyaways. I don't like flyaways. And I've got up front, they were all flyaways for probably about 6 months ago. Now the hairs that you put in are probably about that long. And the gray hair you see up front, which is why I didn't color, is a lot of the new growth that you put in. So for me, it was just getting some hair up front, a little more up top. To me, you can't ever have enough. You can have thick hair. I had thick hair as a kid. I had thick hair as a high schooler, and into my mid-20s, I had thick hair. So when I started losing, it was
your brother's bald.
Oh yeah, my brother. That's the other thing. My brother started losing his, and he just shaved his head. And then the youngest brother has thick hair, but just has the little baseball, and he doesn't mind it. So for every guy out there that doesn't mind it, I think there's a guy that does. And it depends. Are you single? Are you recently divorced? Are you finding yourself out there? Are you the type of person that having a full head of hair helps you and gives you confidence? If you lack in confidence, that can hurt you in the workplace and with the ladies, whether you're single. Wives usually are pretty cool about it. But if you find yourself back out there, to me, I want to finish with a full head of hair. Hair was important to me. It always has been, so it was no question. So the work you've done in the front, my wife is the one person that's noticed, like maybe my father-in-law, people that see me a lot, they're like, yeah, it's really thickened up even more. So that would be what you've done for me.
Very good. Yeah, certainly, neither of you look like a hair loss patient, certainly.
Well, that's good to know.
And that's kind of the point, for a lot of people are worried that it's going to look fake or that people can tell. But, have a look. The hair needs to look, my philosophy is, and this is what I teach the other doctors, the hair needs to look, the transplanted hair, needs to look like it's always been there and not like somebody put it back or it's been stitched on or somehow created by somebody. It needs to look like the OG hair, the original hair that's always been there. So pretty good year then. With your hair. Your wife likes it.
I like it.
Has anybody called you out like, hey, something's different about your hair, or just,
no,
you look great?
No, I've been fortunate. I knew that I was starting to thin out a little bit in the front. And that's when, I came to you and you thickened that up. And I think we did about 2,000. But the thing I liked about you too is a lot of doctors out there that do what you do, that don't have the abilities that you have. They like to advertise, and it's always this much for a plug. And they say the word plug. And it just sounds doll hair to me and freaks me out. But I know the process. You take hair where it grows forever, at least in my case, from the back. And then you go ahead and put it to where it hasn't grown, and now it can grow forever. It's a great process. So for me, I don't like that word plug, but I see people selling it. And the one thing you told me, we'll do as much as we need to. And I went, well, that's pretty cool.
Yeah, I think it's it's a one. Back in the days, they called them plugs. It's really it's a one hair at a time transplant now. So you can really achieve that. It looks like it's always been there result because it's just we can mimic nature very accurately these days.
Yeah.
And so you, my friend, Axel, How is your wife liking it? Has anyone talked about it? How has your year been with your hair?
Yeah.
Your hair year.
Yeah, it's been great. One of the things is we were looking at some old photos,
Yeah.
or some photos from about a year ago, and we noticed that it makes me look a little bit younger.
Mhm.
And she questioned why. She was like, why did they, after the procedure was done, she was like, why did Dr. Anderson put, the hair around the temples,
Yeah.
thicken that up?
Yeah.
And it really helps reshape the face, and it adds to that youthfulness. So there's that. The additional hair, it's more full. I mean, I was receding. I still had a hairline, but I was receding. And at this point, a year later, it probably would have been really, really noticeable and just graduate beyond that. But now I've got, the hairline. You filled in the hairline. It looks natural. It doesn't look like somebody, drew on a hairline. Yeah, it's great. And for the people that I didn't want to know that this procedure was done, they don't know any different, because after that first couple of weeks, the little follicles are there. They disappear. It made me nervous for a second, but I know you reassured me that they're gonna fall out.
My hair's falling out.
But then they're gonna come back, and I would see little hairs growing.
Isn't that the best feeling when you feel them?
Yeah,
You're like, oh my God, there's hair growing.
4 months after the procedure, and I was getting my hair cut, and the person that cuts my hair, this woman, noticed it too, and she was all excited, and I was excited. I go, I guess this is it, but it just doesn't stop.
Yeah.
Then 3 months later, there's more, and 3 months after that, there's more and more, and it took like a full year for it to really come to complete fruition. And it's like every month was like a new present. There's more hair there. It's incredible.
Yeah. Well, I'm glad you like it. Yeah.
Yeah.
And Axel's talking about his temporal points, which are those little triangles of hair just above the ear, and those are actually fairly difficult to reconstruct well, because the hair. But yours look they look very natural.
I had no idea this is what you did.
Yeah.
Wow.
And that and looking more.
You know how I know? Because they're not gray.
Well, it's
I
fun.
haven't noticed that.
I just noticed you're starting to get more gray. It's okay. I've got a great color.
That's all right.
I got a great color.
I'm good with the salt and pepper look.
Are you? All right. Well,
The
just don't
chicks
go all pepper. Here, I mean,
We'll see what happens.
I'll just tease you. I don't care.
It funny story. When I used to have no gray hairs, and back when I was in Beverly Hills for the start of my career, and I would have.
You mean when you were rollerblading on tank tops? I've seen the pictures. You rollerblade.
Well, I played roller hockey
That's what it was.
at Muscle Beach. I played roller.
He was
hockey.
on Muscle Beach.
Playing roller. Yeah, it's hockey though, legit.
No, I'm serious.
And so patients would ask me like, "How many of these have you done? Are you old?" So but once the gray started coming into my beard and into my hair, all the questions about are you experienced enough kind of went away, which was nice.
That's awesome.
But yeah, so I'm not fighting the grays.
No.
But you're hardly gray at all, really.
I like the look.
Right.
We're only a few years apart too.
And I was just looking at your before photos. And, so Steve had a hairline that was already kind of preset, as you mentioned. He's had a couple of procedures, but there was still some room because he had some more hair loss over the years. So we filled in Steve's hairline, but didn't really move it. Axel, we actually filled in portions of his hairline, including the temporal points on both sides, and you do look younger. I was just looking at your photographs on my computer, and it kind of goes to show that and this is a point for the audience, the hairline. People sometimes miss this point. You look at a before and after photograph of someone who's had their hair transplanted, and sometimes they can look almost like a different person. Certainly a lot younger, but there's just something about it. And the reality is that the hairline, including the temporal points, frame the face and really are in themselves a cosmetic subunit of the face itself, like the eyes, nose, and mouth. And so if you have pieces of the frame to the face that are missing, we look at that, someone who's missing those pieces, or some cosmetic subunits, a fancy word for pieces of the face, then the patients look different. And so that's why hair restoration surgery can be so transformative, and it's brought so much happiness to so many patients.
Oh yeah.
So many patients. Oh, I was talking about this with my friends.
Yeah.
It was like, do you ever, if you look at old news footage, half of the anchormen are bald or balding. Half of the movie stars are bald or balding. Now you look at everybody from Matt Damon to whoever it is, and they don't just have hair; they have a full head of hair.
Like Matthew McConaughey too. It's another one. You hear people talk about ointments and things you can use. I do think there are things that keep hair and may even grow a little bit of hair, but the only way to get your hair back is hair restoration. I don't know. Some people, I think, just don't want to talk about it. But to me, why not? It's
Dr.
your hair.
Anderson really wants to get his hands on Prince William.
Does he?
I think that's the only bald person left on the face of the earth.
Yeah, we've got to fix that. He's royalty. He is. And I know he's got the money. He may not have cash, but he'll give you a jewel.
Yeah, well, he's welcome anytime.
Come on in, William.
Welcome to come by.
Come on.
We do have a celebrity program. We do see celebrities here, and we can shut the clinic down for them. But of course, I can't really talk about them here.
Oh, I'd love to hear now. You got me wondering.
Well, in private, you know. Actually, no, I can't. I really can't.
Now you can't even tell me.
No.
Yeah, what the heck?
Privacy is a serious issue.
But you know what happens, because if you're famous, you're either shaved head bald, which is a great look for a lot of people.
Jason Statham has made it look really cool.
Or you have a full head of hair.
Or you got a full head of hair.
Nobody's in between.
No, there's not in-betweeners. No, it's odd to see an in-betweener. There are some people with the confidence, and I'll say to you, way to go, because it is just hair. But to me, hair is so important, so key. The one thing is we can change these outfits. We can be in swim trunks. Axel and I can have our shirts off. It's a beautiful thing. Or we can be wearing, uniforms if we're playing softball or something. I don't know what kind of sport you want to play together. But the one thing you can't change is your hair. And I think that's what bothers a lot of people. You see, and that's what breaks my heart. I can tell when a guy is struggling, that he's doing the cover up, or he's moving his hair around, or hair's combed a certain way to cover up the baldness. And I'm like, dude, just if it bothers you that much, do something about it. But the question you have to ask yourself, do you go to a guy that understands how to frame a face, or do you go to somebody that's just going to put the hair in and let you rock and roll for $2 a grab? I say stay away from that guy. To me, it's your hair, it's your body, and whether you've got the cash or the credit card, man, pay it. It's the greatest payment you'll ever make. It's better than buying a car, if you ask me. If you've got a full head of hair and you've got hair, that's just where I'm coming from. And I know so many people that think that way, but they're struggling with who do I go to? So that's why Axel and I wanted to be here today, just for you, for what you've done for us, because you are the best.
Well, I appreciate it. And yeah, along those lines, I want to point out this is completely unscripted. These guys are my friends, and I wanted to have them back. I'm not paying you guys to be here.
No, the teleprompter.
Please.
What?
Dr. Ballin is a rock star.
Okay. Yeah, no, honest to God, that's the truth.
Just these are not paid endorsements.
No.
These are just my boys, and I miss being on the radio with you guys. Maybe we can make that happen again.
Yeah, come on.
But, great to see you. We're going to go back and we're going to go back and examine each of you under the lights and just have a more of a clinical look at what happened. But thank you so much for making time out of your day to come in to the Anderson Center for Hair and talk to me and by proxy the audience. Thanks very much for your attention. Thanks, guys.
Best in the biz right there.
Yeah, man.